The vision that we have with social and emotional learning in the state of Illinois, indeed nationally and internationally, is to educate students so that their gifts can be realized, so that they live to their fullest potential and contribute in meaningful ways to their families, schools, communities, and society.
Good morning. My name is Dave Cohn. I'm Executive Director of Public Affairs here at the Union League Club of Chicago. And on behalf of the officers, members, and directors of our club, it is my privilege to welcome you here to the Union League Club of Chicago for this morning's program, 2010 Illinois Family Impact Seminar, presented by the Institute of Government and Public Affairs at the University of Illinois. And as the opening act, in addition to saying welcome and to tell you how delighted we are to have you with us today, I want to tell you a little bit about this club and our relationship with IGPA and why we're all gathered here today on this wonderful Casimir Pulaski Day. The Union League Club of Chicago has the distinction of being the only private club in the United States with an institutional commitment to public policy and community service. You may wonder why this place is called the Union League Club of Chicago, and it's not a reference to labor unions. It's a reference to the union that President Lincoln was defending during the Civil War. That's where this club derives its legacy. During the Civil War, there was an organization that arose in the northern states that called itself the Union Leagues of America. And these were groups of citizen patriots who decided that they wanted to do whatever they could to help President Lincoln defend the Union, largely by raising money for the Union Army. And when the war came to a close, these Union Leagues of America, which numbered about 2.5 million Americans at the height of the war, largely went away because their purpose had been served. But those who were active in Illinois, and specifically in the Chicago area, wanted to keep their affiliation going after the Civil War came to a close. And so after a number of years of additional meetings and talking about the importance of democracy and patriotism, they founded this club in 1879. And the importance of that backstory is that it is the reason why the club decided at its very core, in the very bylaws of this club, the Public Affairs Committee is created, and I'm very grateful for that because it means I have a wonderful job. You know, I always talk about the fact that there are many wonderful clubs in this city and in this nation, and this one I regard as rather special, not just because I happen to be a member of its staff, but because we do have a unique mission in promoting good government, talking about public policy issues that matter, like this morning's gathering. That's why we have a partnership with the University of Illinois and the Institute of Government and Public Affairs. It's a relationship that we are very, very proud to maintain. It enables us to bring in extraordinary programming here to the club, to welcome in national and internationally recognized faculty, people who are experts in their field. And this morning's program, what you're going to be talking about, I cannot think of a more salient reason for us to gather here today. The emotional and psychological development of young people provides the groundwork, the very basis, as Professor Gordon and I were chatting about, for all the decisions and really the course of their adult lives. Everything that we know about psychological and cognitive development in human beings points to the importance of what happens during the early childhood years. And I know that you're going to be talking a lot about that this morning. I hope that it's a wonderful and productive session. And again, I thank you for being with us today. We're very proud to be joining with IGPA and providing the venue for this morning's program. So thank you on behalf of the club and enjoy the program. And now I'll turn it over to Rachel Gordon.
Great, thanks so much. And we really appreciate this partnership as well. So thanks for making those comments. And I'm just going to make a couple of other introductory comments and want to welcome you all and thank you all for being here this morning. This particular event is through one of our Institute series called the Family Impact Seminars. And we're part of a network of over half the states that puts on these seminars each year. And the purpose is to bring research evidence around family issues to decision makers, including legislators. And this year is an excellent example of how that's already happened. and how we hope it will continue. I want to thank a set of people before we get started, and one of them is our advisory committee, and there's a list of our advisory board members in your materials, and they help us choose the topic each year and think about how to best structure these events. This year we're also co-sponsoring this event with the Collaborative for Academic, Social, and Emotional Learning, and we have Roger Weisberg here on our first panel, who's president of that group, as well as with Illinois Children's Mental Health Partnership, and Barbara Shaw, who leads that partnership, is here as well. So we thank them for co-sponsoring, and they were both part of our planning committee, which also included some of my colleagues at the university, Elizabeth Powers and Darren Labotsky and Peter Mulhall, who will be on our second panel as well. So I want to thank them all for helping us bring this together. Just a couple of housekeeping things before we start as well. You'll notice the video cameras. Roger's group organized for us to have this recorded through Chicago Access Network. So we'll be able to preserve it and share it with others who wouldn't be able to be here today. And we have a microphone. Kathy Sullivan for our group has a microphone in the back. And when we get to question and answer, she'll bring that around so you can ask your questions on the microphone, and we'll all hear it better, but it'll also then be on the video. And the other two things I'll mention, please take a minute to fill out the evaluation form that's in your binder. That really helps us plan for future events. And there's also biographies and materials from the speakers in there. If you haven't already taken a look, we hope that will be helpful for you. And many who have PowerPoints have their PowerPoints in there as well, if you want to take notes on that. So I'm going to introduce our first three speakers for our first panel on the importance of social and emotional learning, historical and contemporary perspectives. We have, as I mentioned, Roger Weisberg, the president of the Collaborative for Academic, Social, and Emotional Learning. He's also my colleague over at the University of Illinois at Chicago, the LAS Distinguished Professor of Psychology and Education. He'll be followed by Barbara Shaw, who I mentioned is the chair of the Illinois Children's Mental Health Partnership and director of the Illinois Violence Prevention Authority, and then Christopher Cook, superintendent of the Illinois State Board of Education. And we'll take questions from the audience when they're finished as well. So I'll turn over to Roger.
Good morning, everyone.
Good morning.
I was asked to speak about exciting advances in social and emotional learning, but they only gave me 20 minutes to do that. I'm going to do my best, but I'm going to have to prioritize because there are so many interesting, important things going on, and my goal is to share those with you. We come today to celebrate our accomplishments and to plan future directions to promote the social, emotional, and academic learning of all Illinois students. And we have, I think that some people said that there was a 5-year history with the introduction of SEL Standards to the state of Illinois, but clearly the work begins far beyond that into the past. At least 10 years ago, I think we've been working together as a collaborative. The Illinois Children's Mental Health Task Force began back in 2001, I believe. I brought a visual aid. This is a bag I often carry around with me, which talks about the 2003 Policy Academy, where Gaylord and Barb and I and others went to talk about an original vision of what the social and emotional learning standards and policies would be for the state, as well as how would we proceed to promote early childhood K-12 programming for students to promote their social and emotional development. And we all came with, I think, an absolutely common vision about what positive education would be for students. And part of that vision involved having educators, students, families, and community members work together to support the healthy development of all students. So one key message in all of this work is the importance of a collaboration. The second thing that we emphasized is we wanted all students to be engaged, active learners. We wanted to promote their self-awareness, their caring, their respect and connection with others. to help them become responsible decision makers and also to be academic achievers. And then finally, we're looking for students to develop in ways that they can contribute in meaningful, positive ways to their school and community. So there is a statement that's been made on numerous occasions by Karen Pittman, who has emphasized the importance of having children who are problem-free. We don't want children to have mental health problems. We don't want them to be drug abusers. We don't want them to engage in crime. We don't want them to drop out of school. But problem-free is not sufficient. Then she talks about the importance of having students who are fully prepared. And that may be the second box up here. Students who come to school, who do well in school, who are get along with others. But then she goes on to say that fully prepared is not sufficient either. We want students who are fully engaged, those who contribute to the betterment of their schools and communities. And the vision that we have with social and emotional learning in the state of Illinois, indeed nationally and internationally, is to educate students so that their gifts can be realized, so that they live to their fullest potential and contribute in meaningful ways to their families, schools, communities, and society. Now, CASEL has been honored and privileged to work in collaboration with many people around the state to advance this work. And many of you know about CASEL, the Collaborative for Academic, Social, and Emotional Learning. It was an organization that was founded in 1994 as a national collaborative to make social and emotional learning an essential part of every child's education. And we've done that through 3 pillars of work which we see as interrelated. One was we are scientists and researchers who have been committed to advancing the evidence base for work and advancing the science in social and emotional learning. Secondly, we're interested in expanding effective evidence-based practice. So not just any practice, but practice that is demonstrated to work, to have positive benefits on children. And we also focus quite a bit on state and federal policy. I'll talk a little bit about the latest developments for federal policy, but clearly the work in Illinois is the most exciting, the most important work that's been done when we established the social and emotional learning standards in the state of Illinois. And people look to Illinois as a leader in this area, and it's important for us to succeed, not just for Illinois children, but also for children around the country, indeed the world, because people from anywhere from Anchorage, Alaska to Singapore have followed our standards. They've adapted our standards to promote the social and emotional growth of students in their cities and states and countries. CASEL, over time, we feel that we serve as a strategist for the field. We like to collaborate. We have vast national and international collaborations. We are a convener sometimes, and we want to support the SEL community. So the work that we've done in collaboration with the Illinois Children's Mental Health Partnership, with the Illinois State Board of Education, has been very meaningful and important to us over the years. This work began for us in 1994 when we came together, but our first project as a group, the collaborative, was to have 9 co-authors get together and define the field of social and emotional learning. And we published a book with the Association for Supervision and Curriculum Development where we defined the field. It was called Promoting Social and Emotional Learning Guidelines for Educators. This was a book that went out to 100,000 educators connected with ASCD, and then there was a special issue of their journal, Educational Leadership, that went out to 200,000 members of their organization. And literally by 1997, there was a movement beginning to advance the social, emotional, and academic growth of students. In a general way, one of the things that we came together to address was a feeling that there were many, many good things going on in schools, but it was all fragmented. It was all piecemealed. So that if you had a drug education program, a violence prevention program, a character education program, and so on and so forth, that these were well-intentioned efforts to address the social and emotional and character needs and academic needs of students, but there was not a coordinating framework to advance the work. So for the past 15, 16 years as an organization, we've tried to introduce SEL as a coordinating framework where we focus on schools, families, and communities working together, and we think about social and emotional competencies and social and emotional conditions for learning as being the key elements that can produce good citizens, people who engage in effective service learning, people who engage in safe health practices, and finally students who are academically engaged as well. So the value and the interest in social and emotional learning has been seen not because it's another fragmented, isolated program, but because we've worked to think about how all the pieces can fit together in providing positive education for students. Well, the big event, I think, that has really advanced this work over time was the Illinois Social and Emotional Learning Standards. And you know, this has been designed in terms of 3 major goals, 10 standards, many benchmarks and performance descriptors, and it's been exciting work that's been taking place since the standards were introduced, I think, on December 31st, 2004. One of the goals emphasizes a focus on the self, to develop self-awareness and self-management skills to achieve school and life success. A second of the goals focuses on getting along well with others, so to use social awareness and interpersonal skills to establish and maintain positive relationships. And finally, the third goal focuses on decision-making about ourselves and others, demonstrate decision-making skills and responsible behaviors in personal, school, and community contexts. So these were standards that were developed, and it was based on a year-and-a-half process. Ruth Cross and Annette Johnson were co-chairs of the School Policy and Standards Committee and did work convening, I think it was about 25 educators over time, to talk through, it was a broadly representative group with educators and parents, to talk through what the standards would be and to make sure that they would be things that people across the state would be comfortable implementing in terms of emphasizing what students should know and be able to do. Now, in a simple way, this is the simplest slide I can share about social and emotional learning. The goal is to create healthy, wholesome, participatory environments for students, to focus on the promotion of their social and emotional skills or competencies, and when this is done in an effective, well-designed, well-implemented way, that can lead to positive outcomes. Now, a different way to look at this and a broader picture would involve talking about coordinated school, family, and community programming that emphasize social and emotional and academic learning. And the goal is to not just focus on academic success, although that's important, that's the core mission of schools certainly in our country, but also to ensure that students who graduate are healthy, have good social relationships, and are engaged citizens. So the work done in this field, again, is quite intentional, thinking about educating the whole child so that they are not just going to succeed in school, not just be career ready and college ready, but to live contributing productive lives as lifelong learners. We've done a lot of research in this area, and we did something over the past 4 or 5 years. A collaborator of mine, Joe Durlak at Loyola, and several graduate students at Loyola and the University of Illinois at Chicago, where we did something called a meta-analysis. Now, what a meta-analysis is, and I'm going to summarize in 2 slides what took us 4 years to accomplish, but a meta-analysis looks at all the studies that have been done in a particular field. So in this case, we looked at 213 studies in the field of social and emotional learning. These studies all have experimental and control groups and pre and post tests, in some instances follow-up studies as well. And I point to this and I emphasize this because one of the values of social and emotional learning is that there's a strong scientific base to indicate that this kind of programming, when done well, works. So the results of looking across 213 studies systematically, one question involved, does school-based SEL programming positively affect students? And the answer is yes. The second question, and this was interesting to look at, we looked at whether outsiders coming into the school or teachers in the school who delivered programming, what was more beneficial and more effective. And overall, we found that when the teachers delivered the programs, when school-based educators delivered the programs, there was more likely to be positive impact. When people from the outside came in, whether it was a university researcher or someone from the community, there were benefits to that, but the effects were stronger when the school-based educators did the work. And then finally, one of the things we looked at is, were there certain training practices and the quality of implementation, did that influence outcomes with students? So overall, what we found, and again, this is a quick summary, it's of an article that's going to appear in Child Development, which is a very, I think, prestigious academic journal. I can tell you that when we submitted this, we had 5 external reviewers who gave us probably 30 pages of comments that we had to respond to over time. But this has been a rigorously executed study that has been rigorously peer-reviewed, and we're excited to share the results. And there's 2 things, again, I'm going to say this in a very simple way. Social and emotional learning programming promotes good and prevents negative things from happening. That's basically what this slide is emphasizing. And some of this has to do, and it's not surprising when you see something that says 23 percentile point increase in social and emotional skills for students in a program group relative to controls. These are skills that improve kids' problem-solving ability, their ability to generate solutions, anticipate consequences, and the like. We also found that there were benefits on children's attitudes about themselves. They felt more effective in their daily interactions, and they get along and feel more connected to school, was the second finding. A third finding was that their behavior in the classroom improved. They were more likely to be on task, they're more likely to get along well with their peers, etc. And then finally, and this was I think, the major surprising finding for us as we entered into this work, we looked at studies that had been done that looked at academic achievement performance. And there were about 28 studies in our overall group that had done that systematically. And there was an 11 percentile point gain on academic achievement test scores. That means that if you were at the 50th percentile, you would go up to the 61st percentile based on social and emotional learning programming. So one of the things that this suggests to us is this is not just a program so kids can get along, although it accomplishes that. It's not just a program so that they can feel more effective, although it accomplishes that too. It's a twofer or a threefer or whatever, because there's a benefit to the kids in the social and emotional domain, but there's also a benefit to the students in the academic domain as well. And at the same time, we see reductions in conduct problems, in emotional distress, in drug use, in violence. So again, some of the benefits of this program, when it's done well, are very impressive and important, and have important implications, I think, for future educational practice. One of the studies, and this I wanted to just draw this out because it's so interesting and important, has been a series of evaluations done by David Hawkins, Richard Catalano, and their colleagues at the University of Washington. So again, when we look at SEL programs, we look at programs actually done internationally in this evaluation. But they have a program, it's called Raising Healthy Children. It used to be called the Seattle Social Development Project when it was evaluated. And they did programming, SEL programming, between 1st and 6th grade. And now they have been following up those students. Actually now the cohort that they're following has just turned 30. So this is a labor of love, and it points to long-term impact. And some of the things that they've reported at the age of 21 for these students are more high school graduates in their program group, more are attending college, more are employed, better emotional and mental health. They have fewer students with a criminal record. There's less drug selling. There's less comorbid diagnosis of substance abuse and mental disorder. Now, at the same time, and I think this is really important, the Hawkins group has begun to look at return on investment and cost effectiveness data. And what they found, and this is an external review actually of their programming efforts, was that for every dollar invested in the work with social and emotional learning, there was a return of investment of $3.14. Again, this is new work and important work in the field that is to figure out more the economics of implementing this work. What it costs and what it saves is very important. Now, I mentioned that it's important to have good programming, and just to say a bit about what the elements of good programming are, again, to simplify it in 4 bullets, we found that programs that are sequenced, active, focused, and explicit produce more positive gains in kids. So if there's an intentionality about teaching skills, if there's role play and behavioral practice, if there's a clear focus that setting aside time to promote kids' social and emotional growth, and if there's an explicit statement about some of the competencies that are taught, goal setting, problem solving, decision making, that these programs do better than more generic kinds of interventions. It's important to have both adults and students modeling SEL skills and having them discuss relevant situations. So it's not just teaching something on Tuesday and Thursday, but in real life, a teacher has to model these skills when problems come up. There has to be an application for skills that are learned to have discussions to advance this work. There is developmentally and culturally competent instruction and community building that is a major part of these programs at this point. When I say developmentally competent, I'm talking about from preschool through to high school with the work that has been done. And then finally, students need to have opportunities to contribute to their class, school, and community. And you can see that a lot of this is aligned with the Illinois standards that we've worked on. The implications of our findings with the meta-analysis and the research that has been done, the first implication is we believe SEL works. It produces multiple positive outcomes, including academic achievement. It is effective across grade levels, and it has been in elementary, middle, and high school, and it's effective across rural, suburban, and urban school districts. The second thing is SEL is doable. There are very good results from programs run by existing school staff. And then finally, one of our findings is that SEL needs support. Part of this is because we find that implementation matters. If you have a well-designed program and it's implemented poorly, it doesn't benefit kids. So one of the things that we've turned our attention to is the importance of federal and state policies, leadership, and professional development to ensure that these things happen well, the programs, when they're implemented. Now in Illinois, and there will be other people speaking about this, so I'm just going to comment that the work in Illinois with the SEL standards has been major. There was also work early on to influence district policies to have SEL be part of the curriculum and part of student support. There is a big move afoot now to raise educator and public awareness about the standards. There is training in TA being done, and it is important to, as much as possible, identify the ways to promote high-quality district and school implementation, and to have it done in ways that you can have ongoing evaluation and for continuous improvement of programming. So in closing, I want to highlight, these are the messages I'd like to leave about things we're doing now that can be beneficial to the state, and also they're kind of reminders about a few things that I think are very important. The first thing is, many of you have seen Safe and Sound, and Safe and Sound focuses on evidence-based social and emotional learning programs. We have received funding Safe and Sound was completed in 2003. The field has grown and evolved. So we're in the process now of doing a new Safe and Sound, which will be available beginning returns actually by the end of this year and more over the next 2 years in terms of identifying the best evidence-based practices. So again, CASEL will go through a process of looking at the programs, evaluating their design, evaluating their professional development, and evaluating the results in terms of behavioral impact of these programs. Now, so programs I think are important, but programs need to be done in the context of school-wide programming. So we've done quite a bit of work over the last 5 years to say it's not enough to introduce a program. The entire integrated model of implementation is important, bringing stakeholders to the table to do systematic planning. And again, we've had a great collaboration over the past 3 years with Illinois, working and providing training and collaboration with the partnership and the State Board of Education and others to ensure that programs that are implemented are done in a holistic school-wide fashion. And we're also, by the way, updating Safe and Sound, the toolkit at this point. This was a school-wide toolkit, and now we're focusing on district-wide programming and supports that can be done. We're doing a lot in the area of assessment. And we are focusing on teacher ratings, classrooms, and school climate. We've collaborated with Robert Marzano to develop, with a great team of about 25 people from across the state, to develop SEL formative assessments, and are working on the development of standards-aligned report cards. We are upgrading our implementation rubric so that people can look at the planning of their programming, and we're also working with a group out of Penn State on computerized assessment systems to have rapid return of work that is developed. The policy landscape is interesting and exciting. There's been bipartisan legislation introduced by Congressman Kildee of Flint, Michigan, who is the head of the Early Childhood, Elementary, and Secondary School Committee in the House. Judy Biggert from DuPage was a co-sponsor of the legislation, and this is moving forward, and we hope that SEL will be an active part of the reauthorization of the No Child Left Behind law. Also, we're doing an analysis, by the way, of state standards. And again, Illinois has the best state standards, but we're looking at where SEL appears with others. So as we move forward, it's going to be important to continue the movement that we started in Illinois 10 years ago. We need to increase awareness and support for this work. We need to strengthen implementation of state policies. We need to highlight district-wide successes, create a support system for all districts to implement the work. Ultimately, it is the work of the principals and teachers who interact every day with the kids that is so important to make this work. And all this can be done, I think, and we can go back to the days of the Children's Mental Health Task Force, to when 150 advocacy groups came together to build alliances to support this work is really important. What can we all do? Well, part of what we can do is really look carefully at SEL in our own schools and our own districts. Another thing we can do is to provide education to parents, school community members, and local leaders about the benefits of this work. And finally, there's a bigger picture involved that involves state policies, federal policies, new research, new advances in practice, and we want to make sure that as we move forward in Illinois that people are aware of all these developments, these broader developments. So in conclusion, coming together is a beginning, and we did that 10 years ago. Keeping together is progress. That's what we've been doing during the 2000s. And working together over the next 2 years is critically important so that we can provide the best education to our students so that they all graduate being knowledgeable, responsible, caring, and contributing. Thank you.
Thank you. Okay, I'm going to turn it over to Barbara Shaw.
Thank you, Rachel. Good morning, everyone. Thank you so much for being here and for your interest in SEL. As you can tell from Roger's presentation, and I hope you will hear from everyone else today, there's a lot of passion behind this work because there's a strong belief that both the science and just our common sense about what children need in order to be effective people and happy people. We strongly are committed to social emotional learning as the critical aspect of child and adolescent development that it is. We're very fortunate in our state to have CASEL establishing the principles and evidence base for SEL. We're extremely fortunate to have a state school system under the leadership of Chris Cook that has embraced SEL and recognized that we need to take a systemic approach to promoting SEL in the state of Illinois. And we're also fortunate, I think, to have the very many partners that came together through the Children's Mental Health Partnership and Task Force to promote a systemic approach to SEL. Obviously, we were building on the foundation of the principles and evidence base of work that was happening in many schools throughout our state. And I also want to thank those many people throughout the state who started this work in their school environment many, many years ago. You'll be hearing from some of them. Mary Tabija is a great example. So clearly this work had begun 10 years ago, as Roger said, but it was through the lens of children's mental health, their overall social and emotional well-being and their mental health as integral to their health, to their academic development, and to their success in life that brought us to the point of passing the Illinois Social and Emotional Learning Standards. And I think that's a critical dimension of this to keep in mind because as Roger pointed out, the social and emotional learning has multiple impacts. Impacts on preventing the problems, as you pointed out, but also in promoting the health and well-being of children as they exist in their families, schools, communities, and in the world. So we came at this from a children's mental health perspective and recognized that we wanted to have a population-based approach, all kids promotion approach to social and emotional development and mental health, and the learning standards represented that for us. So the learning standards were in the context of a much larger bill that looked at children's mental health from a mental health promotion, prevention, early intervention, and treatment perspective. So it's just a different lens and a different way of coming at the social and emotional learning standards. But we truly wanted to make sure that we were taking a systemic approach across Illinois and hence the standards. The partnership views social and emotional learning in a three-tier approach to children's mental health and social and emotional development with, of course, the everybody gets it universal social and emotional learning as the foundational approach. Tier 2 being responding to children who are at risk or are displaying early signs of social and emotional developmental lag or mental health problems or whatever that are interfering with their ability to relate to others or succeed in school or in family. And of course the final tier being the more intensive services that some children need in order to address their more serious social and emotional and mental health challenges. The partnership has worked very closely with the State Board of Education and with the assistance of CASEL to develop a system in Illinois for conducting statewide professional development that is key to the successful integration of the SEL standards into school education policies and practices. This effort, this professional development effort, which you'll hear more about, our colleague Karen Curry has been the coordinator of that effort in Illinois, and you'll hear from individuals who are engaged in that effort, takes a regional approach to build the coaching and training skills that are necessary to support schools and school districts in their work to incorporate social and emotional learning into their school. We're very proud to say, too, that our approach our statewide approach has a family-oriented approach as well. Family advocates are part of the team of professional developers who work with schools in our state. We're very proud of that and want to emphasize that as an integral element of successful work with school and family. Parents need to know about the social and emotional learning skills that their children are learning in school, and then they need to reinforce them at home. So that partnership between home and school in terms of social and emotional development is absolutely critical, and we have woven that into our statewide systemic approach. We have a long way to go before the SEL standards are fully implemented in all Illinois schools, but hopefully resources will be sustained. We know how troublesome the budget picture is, but we have been very fortunate to have, again, our state board recognizing the need to provide and maintain and sustain some level of support for the professional development that is needed for the social and emotional learning standards. Someday maybe even we will be able to grow those resources and be able to achieve our goals more rapidly. Obviously, we have a lot to do. We do believe that in the long run we can demonstrate in Illinois and in other jurisdictions, states, and countries, but certainly here in Illinois, in the long run, over time, that children's success in school and their social and emotional well-being are significantly improved by the implementation of the social and emotional learning standards. Obviously, as Roger pointed out, this has an economic impact as well, as the need for costly interventions are reduced because children are resilient and they have coping skills and are able to be more successful in meeting the challenges of their development as children and adolescents. So thank you very much again for your interest in SEL, and we hope you, if you're not already as passionate as the other members, people in this room are who are engaged in SEL, that you will soon join us in this very critical work for children. Thank you.
And finally, we're delighted to have Chris Cook, Superintendent of the Illinois State Board of Education.
Good morning. I know we're somewhat limited on time. I'll sort of maybe do some summary comments to encapsulate everything you've heard from my esteemed colleagues here who are great advocates and who are a pleasure to work with as we developed these standards and implement them throughout the state. There's some key principles here to public policy that are working with this initiative that are important to all initiatives. One is, you heard talked about the notion of prevention, getting to kids early as they start to show difficulties, and you see where that's cost effective. That is always the case with public policy. It's certainly the case here, and it's an important notion to think about. The other thing you're hearing about that's important here are partnerships. The State Board didn't do this alone. We do this in partnership with the Children's Mental Health Partnership, which was a collaboration in and of itself with other state agencies working together. And that partnership and collaboration also extending and will extend more in the future to the issue of data collection and longitudinal data systems. And that takes me to the third premise, which is so important, which is just the notion of measuring what we're doing. You heard Roger talk about all sorts of outcomes. These are outcomes that are important to the goals of the State Board of Education. We have 3 principal goals: making sure kids are all career and college ready, and that they all have equitable opportunities towards that, making sure teachers and administrators are prepared to do the jobs they do and do them well, and making sure that we have safe and healthy learning environments for all kids in the state. And all those things have measures, and you hear the measures here that are so important. The other notion here from a public policy perspective that's so important to me is looking at the whole child. The idea of school not just being about academics or acquiring language arts or math or those things measured by No Child Left Behind, but that a human being has many dimensions that are important in development, that we need to be paying attention to those as they develop, even before they're born. These are important. We learn more about the brain and brain development all the time, and the more we learn, the more we need to use that in guiding policy. So those 4 principles are important with this initiative and important to what you're seeing happening. Think about what we're talking about kids getting here. Recognizing and managing emotions, developing compassion for others, establishing positive relationships, making responsible decisions, and handling challenging situations constructively. Imagine if every past and current policymaker in the state had those skills, where would we be? This is great stuff. So, these are things that we all need as human beings in order to be fully actualized and doing our work well. So, you've heard Roger speak to the kinds of measures that we think are great: student academic performance, graduation rates, improved teacher and staff performance, and professional satisfaction and retention rates. They're all great things. We have 33 school districts and 71 schools are in their third year of implementation of the pilot project with the standards, and we're in the process of scaling this up statewide so that all districts and schools throughout the state can have access to this. You probably also might know that approximately 14 to 20% of students face serious emotional behavior challenges that interfere with their ability to learn, and in high poverty schools and high poverty areas of the state, that percentage goes up to nearly half of the student population. So you see how important it is to our work. We do have both federal and state money, to not enough, but some, in order to help us with the implementation. FY06 to 08 federal grant to integrate schools and mental health systems was available here in Illinois, and there were 15 districts and 61 schools in the first cohort with that initiative. We also have a state appropriation. We've provided a second round of grants to schools. We have 12 districts and 57 schools in that cohort. And our goal here, again, with that money, expanding professional development, developing coaching systems, expanding regional learning collaboratives, and developing the vision, sharing communication plan statewide, as well as an enhanced evaluation system, which is so critical. So I appreciated the opportunity to talk to you briefly just about how important this is to the state board, and as always appreciate your support and leadership as well. So thank you so much.
Thank you. Thank you to all our panelists. We've got time for a few questions right now. And I'll just remind you, our next panel will be about implementation, and then our final session will have some more extended discussion and conversation. So if you don't have a chance to ask your question now, we'll have that period as well. So Kathy, if there's anyone with a question, put your hand up, and Kathy will come with the mic. And you all can start with mics as well. Okay. Just one at the back table, and then we'll come back.
My name is Marcia Zumbalin, and I'm here as co-chair of the Policy and Advocacy Committee of the Illinois Association for Infant Mental Health. And we sit on the partnership as well, and I just wanted to thank Barbara for her stressed intonation of the word health when she said children's mental health. And I think this is a wonderful example of how we're starting to flip the perception of what mental health means, specifically when we talk about children. And I know that the partnership's agenda is to cover birth to 18. And when Roger spoke, he talked a lot about, I'm assuming, K through 12. And when Christopher spoke, he talked about prevention stuff. So I guess I'm trying to look ahead and ask, maybe out of curiosity, what your plans are for the birth to 5 population.
Actually, I wonder if I could call on Gaylord Gieske to respond to that. There are social and emotional learning standards for the younger set, and I know that the committee that Gaylord co-chairs, the Early Childhood Committee, has worked on this whole issue. So Gaylord, I wonder if you could.
Great question, Marcia. I'm really glad that we get to add that into our conversation this morning. Actually, the early childhood community in Illinois had been involved in creating early learning standards for birth to 5, even predating the beginning of the mental health task force and the partnership. And so this has been on the early childhood agenda for some time. Illinois did adopt early childhood learning standards, I think around 2000, 2001, somewhere in there. We were the first state, I believe at the time, that did have some references to social and emotional learning standards for young children birth to 3. They were at the program level, in other words, what the environment might look like, and from 3 to 5 they began to focus more on some basic SEL skills, if you will, that young children would need as they leave preschool and are ready for kindergarten. What's exciting is that work in Illinois at the time was somewhat pioneering. We recently did a study at Voices to find that across the country, virtually every state now has social and emotional benchmarks for 0 to 5, benchmarks or guidelines. Some of them very, very well thought out, and they have leapt over us, and we are now advocating in the Early Childhood Committee and with others that it's time for Illinois to relook at the social and emotional learning standards, particularly if we get the federal Early Learning Challenge grant becomes a reality. And so we hopefully will be moving ahead and redoing our early learning standards. I think a challenge to us all is to make the alignment between birth to 5 and K or preschool and on up, so that while the early learning standards for birth to 5 might look structurally a little different, the main 3 goals would be there, the spirit, what it involves, what you're looking for in environments, and from teachers and others working with children would be aligned, so there would be a smooth way to go from birth on up.
Thank you.
Thank you, Gaylor. I know you had
Can I add?
Yeah, go ahead.
Okay. I just wanted to add a way that CASEL can be a resource for an undertaking like this. We convene groups, as I said earlier, and with funding from the Gates Foundation, the Rauner Family Foundation, the Curlin Foundation, and the University of Illinois at Chicago, we have an SEL assessment work group. And that has local experts like Karen Friel from the Ounce of Prevention, and national experts like Ross Thompson from the University of California, Davis. And we're coming together, and there are 2 papers, scholarly papers, that we're working on right now. One is on preschool standards and assessment, and the other is on elementary school standards and assessment. And those will be done, I think, over the course of, by the end of this year. And we, as a part of that, have done reviews and looked at some of the early childhood standards, although it's not my area of expertise. And we've looked at Washington and where Lynn Kagan, I think, worked to develop birth to 5 standards, in Texas and Pennsylvania we've been looking at more recently. So there's a lot of good work out there, and we're trying to get a handle on some of that in the context of first scholarly reviews and then links to standards and quality assessments. We work with somebody also, Suzanne Denham at George Mason University, who has quite a bit of expertise in this area. So if there are ways that we can help along the way, because Gaylord's comment about the importance to integrate the early childhood with K to 12, I think is major, and that's hopefully going to be the next advance to where Illinois can show the leadership. The integration from birth to 18 or even 21 would be really spectacular.
Probably got time for one more question. You're right here in the red.
My name is Janet Keczkowski, and I'm a board member from East Main School District 63. And I was just wondering if Christopher Cook, if you could talk a little bit more about the pilot project in the state, where to get more information on that, and if you could talk about the plans to expand that. Thank you.
Well, certainly. I mean, you can, we have a coordinator now, liaison. If you contact the state board, we can help connect you to the work of the pilot program. You can call our main number. You could email me if you like, and I can certainly connect you to that. And our main number is 217-782-2223. You could ask for Beth Hanselman's division, and she could direct you to them, or you can ask for us. And in terms of expansion, of course, is directly correlated to funding oftentimes. That's something that we're going to be advocating for heavily now. The board had projected level funding budget in relation to the prior year, so we know that will be an optimal situation given the fact that we have this disastrous funding cliff where we've been using federal money, and now the state is having to come up with that difference. But we're going to keep this in our budget. That was a unanimous decision of the board. They're wanting to keep this as a focus. They know it's important, and we will try as hard as we can also to go after any federal dollars as they become available to ensure that we have money to leverage towards this important work.
All right, thank you for our first panel, and we'll take a 15-minute break and have our second panel on implementation.